we are remarkably on time to move on with our program. And the next segment we are about to dive into will talk extensively about telehealth and digital medicines. This is a sector that we heard has been booming for the past months for obvious reasons. The real question now is what we really learn from these approaches and how we will move this forward. With this, our next segment host will connect from San Francisco, is Jessica Damassa. Jessica is one more friend of us, has been involved in a number of past events, helping through filming and interviewing to spread the knowledge about digital health. So, Jessica, welcome to your first Frontiers Health Live. We can't
Hello?
hear you. Yeah, now we can hear you.
Okay, great. I don't know what happened there. I was not on mute. For the record, I was not.
I mean, this is live, so we will not edit this. Thank you so much for making it. Did you do the exercises as I did?
I did, but I was going to say, poor Donald, you can't tell because my energy level is usually so high. So even with the deep breathing, this is me relaxed.
Fantastic. I think you need a different kind of exercise to kind of chill down given your energy levels, which we love, by the way. Okay, so with all this said, I'll let you lead your segment and leave the stage in your hands.
Great. Thank you so much, Roberto. Thank you to everybody at Frontiers Health Live for having me here. So usually I get to travel around the world and talk to the who's who of health innovation and find out what's going on. But don't think that not being able to get on a plane has stopped me in any way. I'm actually much more dangerous with Zoom. So before we kick off this segment and hear from 3 companies that are working on the front lines in telehealth and digital medicine and have been, figuring out what's happening there in that space, I want to just kind of level set and, maybe bring up the conversation and summarize and synthesize some of the things that have been happening around telehealth, digital medicine in this space, and the 3 big questions that keep dominating the conversation as we move towards reopening. So I'm hoping that as we hear from these startups, maybe we'll get some clues about what's happening next. But the 3 big things everybody seems to be wondering, and we've been hearing them today as well, is number 1, what's going to happen to utilization rates as we move forward? So 2 sides to this conversation from what I'm hearing. Obviously, the consumer side of this. So what are patients going to do when choice comes back into the equation? Are they going to continue to choose a virtual care option, or are they going to go back to the doctor's office? We're in a process of waiting and seeing, but that's definitely a conversation that is happening right now. The other side of it is on the physician side. What are physicians going to want to do? A lot of them have habits of seeing their patients in the office. Has this been enough time? It takes 21 days to make a new habit, right? But has this been long enough, and have they seen the value enough in virtual care and digital medicines and remote monitoring to really make that change? And we're going to have to see about that as well. One of the important factors in that conversation, at least here in the US, that I want to bring up, one of the big things that we're talking about is reimbursement. On the reimbursement side of things, here during the pandemic, telehealth visits and some digital care has been reimbursed at the same rate as in-person, which made it very easy for a lot of hospitals and physicians to adopt going virtual. Moving forward, we don't know if those reimbursement policies are going to stay. So lots of questions about what the financial model will be moving forward. At the same time, we're looking at the regulatory environment. That's the other part of this conversation, is the regulatory and what is going on with the FDA in terms of, some of the fast-tracked approvals that they've made for digital medicines, different remote monitoring devices, different digital therapeutics. Are those going to stick? And what about some of the important licensing changes that happened here in the US that made telehealth so much more broadly available? So for those who are international, you may not know this, but if you are a doctor, you're licensed by the state. So a lot of doctors don't have 50 licenses, so they can't practice across a state line. So if you're a doctor in New York and you're licensed there, you can't practice in New Jersey unless you're licensed in New Jersey. That's been lifted through COVID-19. We're going to have to see if those regulations remain lifted or if they go back to the way that they were before. What I'm hearing is that it's likely that those will revert back, just because of state licensing boards and also because of medical malpractice insurance risk with doctors practicing broadly like that. The last topic of conversation, the last big question is what's going to happen to the market. And we heard from the investor panel a little bit earlier about some of their concerns. It was a great conversation, so thank you for that. Here in the States, we're watching Teladoc Health and Livongo Health. Those are our publicly traded digital health companies, telehealth companies. So we're watching their stock. It's gone way up during the pandemic. We're going to see if that's sustained or not. We've seen some massive fundraising just this week. Amwell, which is a huge telehealth provider here in the US, actually globally now, they raised $194 million. They announced that on Wednesday. Also, Omada Health closed a $57 million round. They acquired a telephysical therapy company with some of that money. So a lot happening in that space. And the big questions here about what will happen to the market, we heard it in the investor panel, and I want to reiterate, are on the hospital financial side. Are the hospitals going to be in financial shape to integrate these solutions moving forward? Not sure. And then one thing not to forget here, especially for those who are in an international location, in the US, our health insurance is tied to our employment. And so with so many Americans being out of jobs, the new jobs report 38 million Americans out of jobs. A lot of them are losing their health insurance. So what's going to happen moving forward in terms of how some of these new telehealth, virtual care, remote monitoring solutions are deployed? Are those mechanisms still going to be in place in the healthcare ecosystem and the healthcare business model to support that? So we will have to find out. And I'm hoping, like I said, that these three companies that we hear from are going to be able to weigh in with some perspective for that. So I'm going to kick things off and invite Antonella Armamente from Pagina Medica to share with us her experience from the Pagina Medica side and what they've been working on. They're an Italian-based startup. They have a really robust digital health platform that includes a chatbot that does some symptom checking for COVID-19, also provides telehealth, which they stood up, from what I understand, very rapidly in order to move quickly to provide care in Italy, which was, as we all watched around the world, one of the hardest hit areas with COVID-19, and really had to jump at this first. So Antonella, we are so excited to have you here, and we are so looking forward to hearing what's been going on at Pagina Medica and all the great work that you've been doing. Take it away.
Hi, Jessica. Thank you. And thank you for your introduction. Do you see my screen?
I think it's coming, and yes.
Yeah, okay. So thank you again, and I'm very happy today to be here to join with Pagina Medica this live event to find all together the pandemic digitally too. Well, what's Pagina Medica? Pagina Medica is an Italian digital health platform that connects patients to doctors and provides digital health services that are aligned to the patient journey. Of course, during COVID-19 outbreak, we developed a lot of several digital health services that I'll be presenting you very soon. But before, I wanted to spend few words to explain what is Pagina Medica. Pagina Medica is an integrated platform that combines two kinds of approach. On one side, we work to digitally empower the doctor, and for this reason, our platform provides a medical support system, telehealth services, and enables DTX orchestration. And on the other side, through our platform, we want to provide a personalized health experience to our users. So our users can register to the platform, can have an access to a personal dashboard where it is possible to connect wearables and apps. And in this way, the users have a dedicated access to specific content and specific services that are aligned with their needs and their condition, of course. Every month, we register about 2 million users, 2 million unique visitors on our platform. And until today, we have registered more than 80,000 active patients that are using our digital health services in order to create a connection with our doctor, with more than 140,000 doctors that are registered on our platform. And we were online since 2015. And on the screen, you can see the results that we have already collected since we were online. But let's talk about COVID-19 and our response to this pandemic. Our response started before the World Health Organization finally declared the pandemic. And in fact, it was February 7th when we launched and developed a chatbot tool that provides correct information about the COVID-19 and helps both doctors and patients to predict the possible transmission of the virus. This chatbot was designed under the medical supervision of Dr. Emanuele Urbani, that is a a general practitioner in Milan, and he's also our chief product officer, and it is constantly updated on national and international guidelines. And in this sense, the chatbot is also part of the national campaign I Stay at Home that wants to motivate citizens to understand the importance of containing the spread of the virus. Our chatbot is proving effective into giving correct information, but most of all into facilitating triage cases that are showing suspicious symptoms and behaviors. So in this sense, if we have a COVID-19 suspected case, the patient can be connected via telemedicine to our platform to a physician. One important thing that I want to say is that our chatbot is web-based. And in this sense, it has been constantly updated as the epidemiological situation changed. In this sense, a lot of Italian institutions decided to embed our chatbot in their websites, so they could collect a huge numbers of data, and all these collected data are completely anonymous, of course, because there's no registration for users that want to use our chatbot. And these data are centralized in a database that is made available to the health authorities, including World Health Organization. And this is very important because you can imagine that now we have a very huge of self-reported symptoms that are directly imported by people that are using the chatbot. And we have to consider that, for example, also CDC and Apple have followed the same type of strategy. For example, creating a similar solution for the American users. Through our chatbot, patients with COVID-19 presenting with mild symptoms are invited to use our digital service named Visitami. So they can access a remote monitoring system that allows the patients to be monitored staying at home. So patients can insert every day in a very simple way and without the necessary use of a device, their symptoms. And if a symptoms or a value is altered or suspected, the platform sends an alert to the doctor. And in this way, the doctors can connect via video visit to this patient. So in this sense, we created a free of charge initiative in Italy to support Italian doctors during the COVID-19 outbreak. This initiative is called the hashtag Video Visito, That means I video visit you. And through this initiative, all Italian doctors are be able to access to our digital health system and our video visit in order to be connected with their patients. And during the video visit, they can share also documents and other type of files. Of course, the connection through the video visit between doctors and patients takes place in a confidential way and in a private room. So this is our solution to fight the pandemic, and it is composed by a chatbot for triage symptoms, by a remote monitoring system, and by a video visit solution. And we are experiencing great traction in this sense. Consider that after only 2 months that we launched our COVID-19 solution, we have registered more than 160,000 patients that are managed through our platform. And there are a lot of doctors that are sharing on social media their satisfaction about our platform and about our digital services. And our initiative, #PVideoVisito, I video visit you, is very recognizable by not only in Italy, but also abroad. So what's the next? What we do with our platform in the next future, in the new normal, we have to consider that COVID-19 has posed a significant challenge for our healthcare system in Italy and all over the world. And in this sense, we have to consider that technology and also digital health platforms such as Pagine Mediche become extremely useful into manage not only the patient with COVID, but to manage other conditions too. Most of all in primary care, where the continuity of care is very important, is a core value. And so in this sense, we are already working with the national health system, with the regional health system, and with physician networks and other institutions to expand our platform. More specifically, we are providing a set of paid services to offer a better access to doctor with a system that suggests to patients the best way to book a visit or how to meet the doctor via video visit or in presence. And it is a smart access solution that is compliant with the new regulation to avoid the crowd. In the meantime, we are ready also to foster a connection among doctors, a better connection among doctors through, for example, the video consultation for both specialists and also general practitioners. And we are working also on improving the continuity of care from territory to hospitals and also vice versa through the activation of the digital health services provided by our platform. And last but not the least, as our country develops a DTX strategy, you have to consider that we are focusing on providing a unique DTX orchestration solution. And so we hope that our solution and our platform will be very useful for Italian people, of course, but why not for all other people around the world. So if you need or if you want to have more information about our platform and our digital health solution, please contact us. And for any other information, you can visit our website.
Antonella, thank you so much. That's fantastic. What a great update. It's fantastic to hear from you and also to hear about all of the great work that is coming out of Italy at Pagina Medica. So thank you so much for sharing that. It's a pleasure to have you. Great.
Thank
So
you.
we are going to move on to the next company in our session here on telehealth and digital medicine. And so I would like to welcome our next speaker. This is Jalil Alabedi. He is the CEO of Altibi, which is the largest digital health platform in the Arab world. So I was blown away, Jalil, by the numbers of people, and I'm sure that these numbers have gone up. The last I read, 80 million annual visitors on your platform, 25,000 doctors. I mean, this is remarkable. You guys have been around for a while, launched in 2008. And I understand that you're providing, in addition to a lot of information about, healthcare information, medical information, you also provide 24/7 telehealth services. So to folks in the Middle East and also North Africa. So Jalil, it's a pleasure to have you with us today. Thank you so much for joining us. You might want to take yourself off of mute right now. And as you're sharing your slides, make sure that you're in presenter mode. So Jalil, let's hear what's new at Altibi. Good to have you with us. Take yourself off mute.
Unmute. Okay. Can you hear me now?
There we go. Yes, we can hear you now. Welcome. All right, start from the beginning and give us that update on Altibi. And be sure to go in presenter mode. Thanks.
Thank you so much. Thank you, Jessica, and thank you for having me here. And it's a pleasure to present Altibi, which, as you mentioned, has been around for a bit now around MENA. It is definitely the largest end-to-end digital health platform in the MENA region. Just quick numbers, as you mentioned a bit of them. We have 20 million visitors every month to our website, and we have run more than 1.3 million consultations so far in the last 3 years. And we have 18,000 active doctors daily adding content and consultations to our website, to our platform. But the problem in MENA is very bad even before or prior to the COVID situation. We already have 60% of the population in MENA that is uninsured. They're paying a lot out of pocket to cover their healthcare expenditures. And at the same time, we have higher than average visits to hospitals and doctors. And with all of that, we have lower life expectancy rates in this part of the world. So Altibi is essentially, again, an end-to-end platform. We provide content, telehealth, and ultimately bookings and clinic management system, which we launched only late last year. But when it comes to COVID, we actually witnessed something really extraordinary. As you can see from the numbers, we have seen a surge in the number of consultations on all levels. And not only that, we've seen the growth and the surge across all our offerings. From the consultation side, we have launched a couple of initiatives, and also with our B2B partners, we've seen a tremendous growth in the number of consultations, but also in the B2C, direct-to-consumer offerings. We have tripled our number of consultations since before COVID until now, which speaks volumes about now the adoption of telehealth among consumers themselves. When it comes to doctors adopting our clinic management system, which allowed them to conduct virtual consultations with their patients, we can see that until the first 5 months of this year, we have added more doctors using our clinic than the entire 2019. Which also says that things will be changing. What allowed us to scale are a couple of factors here. One of them definitely is user adoption. We've seen that with all the lockdowns, people just had to go through virtual medicine and telehealth consultations. But our operating model was extremely valuable, so I'll speak about it a little bit more. And of course, we had to accelerate the adoption of technology in machine learning and AI to really augment and allow us to scale to be able to tackle these peaks. Working with government was something completely different, something completely new to us, which exposed us to different scales in managing telehealth and digital health. So when we talk about our operating model, our doctors are freelancers. We definitely go through a long and difficult onboarding process, but we keep onboarding month on month to be able to handle the ups and the downs of the demand. As you can see from the graph below, we have seen a surge and down from the doctors we were adding and using the platform to cover the peak. These doctors do not need any special equipment. They have an app, an Al-Tibbi app for doctors, where they can just log in and they start receiving these consultations. And of course, we manage all the quality from the back end to make sure that nothing is being compromised, although the numbers have been changing completely. For that, we really had to accelerate our machine learning module development. So we introduced a couple of very important modules that augmented the decision-making process of the doctor to make the proper diagnosis and propose the right treatment. Again, it was a very difficult situation. We were running through a lot of government initiatives. I can mention one here. For example, we launched the 111 hotline, the Corona hotline in Jordan, together with the government, the Ministry of Health in Jordan. We had to take over entirely the whole line, and that the objective was to reduce the footfall on the hospitals and the clinics, and direct people to stay at home if they don't need to, with the proper advice. And those that we diagnosed with high risk, we had to divert them and direct them to the Ministry of Health to be taken care of. So we really had a big responsibility here. And as you can see again from these numbers, we reached peaks of 13,000 consultations a day. But we managed to have that without compromising the quality at all. And the maximum waiting time never exceeded 1 hour to get on a call with the doctor. And that helped patients really go to stay at home, get the right advice, not to panic, because we reached some situations of high panic levels in Jordan, and everybody wanted to be tested. We had to really calm people down and just have them stay at home, not go to the hospitals, etc. So from all of that, we can see a huge impact of digital health on this situation. By the way, we launched initiatives like these with the government of Iraq and the government of Egypt. So basically, our service now, telehealth services, are covering 150 million people with hotlines for Corona and free services for the Corona situation. The economic impact was incalculable. You can consider that the average cost of an in-hospital consult is $10, while we were providing these consultations at less than $1 to provide the right advice for patients and keep them again safe at home without mixing, reducing the mix-up, and having them stay at home. The social impact was tremendous, because you can consider that not only that we wanted to keep people at home, but at the same time we wanted to reach people who could not get to a hospital at all. We wanted them to come down and have the right advice and even direct them to the right direction if they needed to. And these are people from people from areas far away from a big city where health services are lacking in this part of the world. The changes that we will see, and we're lobbying now for those, because now with working with the government, these governments were actually contrarian to anything related to digital health only a few months ago. And now we are seeing that these governments not only asked for our help, now they're asking us, how do we manage to do that? What are the right ways and the right regulatory systems do we need in place so that we can keep carrying on such things and have them regulated, have them going line in line with the laws in the countries and with the payers, etc. So this is something that we're seeing. It will carry on beyond COVID. I think now the habit has taken on, and regulators have seen the impact, and they are more excited than ever to take this forward. and this is what we're working on. In terms of coverage, payers are extending coverage to telehealth. They are working on that. We are already working with some top payers in this region, and we are seeing many more converting to telehealth and offering this to their beneficiaries. But it's a very big aspect we need to really mention and talk about is how do we keep that sustainable? How do we take this to the next level? How do we work with these governments on the long run? How do we intensify relationships with pharma, because they are a key component of digital health as I see it? And then how can we provide more integrated solutions? With all of these put together, things will be more sustainable more than ever beyond COVID. This will take on and make digital health something, a key component of healthcare across the world, but specifically in MENA, where we have deeper problems and more severe problems than any other part of the world. I hope I got the message right and clear. Thank you so much. If you have any questions, please direct them to me, and you have my contact here for anything further. Thank you so much.
Jalil, thank you so much. We have a few seconds here, so if you can hang out and talk to me for just a minute or two. I do have a follow-up question. I'm curious about the reimbursement climate. So you said you're working with payers on reimbursement schemes and moving forward. I know when we kick this session off, that's one of the questions that here in the US we're wondering about is whether or not virtual visits are going to be reimbursed at the same amount as in-person visits. Can you tell us a little bit about what that's like right now? Where you're serving patients, are visits reimbursed at the same amount, or is it a different amount for in-person versus virtual?
So the approach we took was actually to work with payers to provide our service as a first line of defense. So basically it is mandated or not, actually it's an optional service for every beneficiary. And we would be paid as a subscription. We would be paid for each beneficiary and offer these beneficiaries unlimited consultations 24/7. This is the approach we took instead of being reimbursed per consultation. But I'm seeing this, this was a really hard thing to accomplish at first with the first payers. And the others were not adopting anything, so they're not reimbursing consultations, neither they're paying the subscription fee. And I'm seeing this changing quite a lot. And we're getting more and more demand from payers asking us and even consulting with us about what is the best approach to go forward with that. Definitely our best approach would be just to make this the first line of defense, to be mandated actually on everybody to have a teleconsultation before going directly to a hospital or a medical center.
I think that's a trend we're seeing here too, is this idea of digital first and matching that lower cost to lower acuity to try to offload the burden of the healthcare system and also to realign the cost structure as well. Thank you so much 100%. For your presentation and for sharing your perspective. It's so exciting to hear how telehealth is just scaling around the world. So thank you so much for sharing with us about LTB.
Thank you so much, Jessica.
Thank you. Thank you. All right, up next, we are wrapping up our panel here on telehealth and digital medicine by talking to a digital medicine company. So I would like to welcome from OneDrop CEO, Jeff Dashis. So for those who are not familiar with OneDrop, this is one of the leading diabetes care platforms in the world. And Jeff, I know you guys have been busy. You've been acquiring some IP and assets in the month of April. I hope you get into that in your presentation. I'm looking forward to hearing more about that. And also about some of the things that you've been doing to provide care to one of the populations of patients who has been identified as really being at high risk for contracting COVID-19 and really having complications if they do become infected. So making sure these people stay out of the hospital, stay out of the doctor's office, and can take care of their condition at home. So Jeff, without further ado, I will turn it over to you. Welcome. Thank you so much for joining us today.
Thanks for having me, Jessica, and thanks to the entire Frontiers in Healthware team. Roberto, thank you. Hats off to you for putting on what I think is really an outstanding event. Let me start my presentation. Can you all see my presentation?
We're getting there, Jeff. This is the voice of God, aka Jessica. And when you share those slides, please do it in presenter mode too, so that we can get absorb the full beauty of what you're sharing with us.
I'm in full screen now. Can you hear me?
We can hear you, but we cannot see your slides.
Okay, let's see. I'm in presenter mode.
Share your screen.
Yep, there we go. Perfect.
Perfect, here we are. All right.
Okay.
All right, go for it, Jeff.
All right, thanks again, everybody. You know, in a lot of ways right now, we're seeing the best of times for digital health. You know, for the first time in years, the public expressing a broad appreciation for the true humanism and heroism of healthcare workers. And I have to just offer my hats off and my sincere gratitude and appreciation for all of the healthcare heroes worldwide. Really, it's something outstanding to see, and I'm grateful for everybody's effort there. We also are seeing for the first time broad recognition of the power of our healthcare system, but also, you know, its limitations. On the regulatory side, it's exciting. We're seeing federal and state governments, they're biasing towards common sense rather than sort of this rigid adherence to laws and regulations, which is allowing for a lot of really interesting things to be happening in telehealth. And telemedicine delivered through handheld devices, finally, ubiquitous for more than a decade, are finally being reimbursed in some way. We're seeing, you know, Medicare and Medicaid and private health plans all reimbursing telehealth in some way. So in a lot of ways, you know, this is really an exciting time for digital health. But will we waste this moment? I mean, underneath all of this healthcare innovation, transformation, and rebirth, will we manage to waste our efforts? Will this be the single most important, you know, evolution and renaissance of our healthcare system, or will it be remembered as a huge missed opportunity to get things right? Will innovation and reality finally converge, or, you know, is there a future outside of high margin molecules and fee for service payments? Can we converge our aspirational ideas and visions for where healthcare can go and where digital health can go, and the future and front lines of the existing care system? Can we bring not new ideas to the table, which we've been doing for years upon years upon years, and Jessica, you've, you know, been reporting on this, but can we bring a new sense of pace and scale, a sense of urgency to the matter? I think now's the time that we have to. When you're diagnosed with a chronic condition, your whole life changes. You go from feeling out of control, your doctor is taken over managing your health. You only see them for a few minutes a year. The rest of the time, you're trying to manage on your own, and a healthy life seems almost impossible. You search for the magic pill to make you whole again, and it feels so alone and afraid. We have to know that a better way is possible, where we reimagine your health, your limits, and your life. Imagine having an ally with you during the thousands of hours per year when you're not at the doctor's office. Having a one-on-one coach that gives you answers and advice and encouragement in real time so that you can reach your potential and you can go further. Rooted deeply in data science and behavioral science, you change your habits and stick with them. You begin to feel stronger, more capable, and in control. And you stop searching for the magic pill and instead use your data-driven insights to prevent problems before they occur. High blood sugar, high blood pressure, heart attack, and stroke. Imagine the possibilities for your future and where you might go. Every piece of information you share opens up more possibilities not only for you, but at the same time for millions of other people just like you. At no time in history has it been more apparent that we're all in this together. Imagine having back your time, your power, and your life. Imagine giving back this time and power and life to millions of people around the world. With this, we could have the potential to solve all the current problems facing our planet. We could harness all of that human potential and we could change the future. And together, we would create new possibilities for humanity. It's in this type of event with these type of people that are all around the world today tuning in to this event. It starts right here. We have an opportunity to see a world where humanity surpasses its potential, a world where we can transform health, where we can change lives, and we can create new opportunities for everyone. I want everyone who's tuning in right now to think about reimagining possible. And that's what we're doing at OneDrop. OneDrop's a digital health company. We're harnessing the power of data science and behavioral science and mobile computing to transform the lives of people with diabetes and other chronic conditions all around the world. OneDrop offers a digital, personalized care solution. It's clinically validated, it's effective, scalable globally, and it's delivered entirely through the OneDrop app. People can get support wherever they need it, whenever they need it, and at any time. And I want to say we believe in the power of prevention. We want to solve problems before they occur, not treat the symptoms of problems after they've occurred. And I'll say this again, OneDrop is for people, not for patients. People go about their lives every single day, doing all the things that they normally do. They go to work, they have relationships, they have kids and families, and they might happen to also have a chronic condition. It's only at the doctor's office that they become patients. So for the 8,759 hours a year that they're living their lives, that's where OneDrop comes in. OneDrop is for people, not for patients. OneDrop was built for the new normal that COVID-19 is forcing on us. And I'll say this, telehealth is here to stay. It's not going anywhere. OneDrop is a consumerized product, not a medical product. It's predictive and proactive, not retrospective and reactive. We're about changing behavior and not treating the symptoms. We're about personalized care, specific for the individual, not generic or impersonal. We're humans, not bots. We're about asynchronous communication, not about episodic care. We are real-time data for you and for your coaches, real-time education and information for you and delivered by your coaches, real-time data-driven predictive insights to help you see what's going to happen and make changes before bad things happen. We're integrated, not siloed. So we integrate thousands of apps that are out there for food, for physical activity, for medication, and for a variety of other digital health devices. We work with Dexcom, we work with Companion Medical, you can control OneDrop with Amazon Alexa or Siri. OneDrop is an open, fully integrated ecosystem, and we're accessible globally for multiple conditions worldwide. A little bit about us, we're a little over 2.5 million users from 195 countries utilizing OneDrop in 11 languages. We've ingested over 11 billion health data points from over 75 biomarkers, and this data is powering all of the OneDrop predictions and our OneDrop adaptive support. We're one of the top 3 digital diabetes platforms worldwide. We're a top 200 health and fitness app on the iOS platform with over 13,000 4.5 star and up reviews. We've seen 400% growth in monthly active users year over year. We're the only health platform out there delivering real-time glucose predictions up to 8 hours in advance. And we're delivering programs for our customers for diabetes, prediabetes, hypertension, high cholesterol, and weight loss. Our business model is meeting people where they are. We're a subscription service at our heart, including service, software, and hardware. We have a B2B2C model for employers and health plans that we sell through brokers and benefit consultants or direct to employers and health plans. And we also have a direct to consumer business for individuals where you can buy our products, our hardware products, via retail stores, at Apple physical retail stores, in Walmart physical retail stores. We'll be in over 1,000 CVS physical retail stores, Best Buy, and a bunch of others. You can also purchase our subscription services through our app or download the app for free anywhere in the world. You can also buy our products on the web, either paid subscriptions or hardware. OneDrop is about meeting people where they are and delivering them the right solution at the right time for what they need when they need it. OneDrop's rooted in a consumer experience mindset. And unlike most health companies, OneDrop's an ally to those living with chronic conditions because we know how to connect with our audience. I have type 1 diabetes. I engaged with the healthcare system in a way that I thought was idiotic. It was impossible for me to access the data and information that I needed to make choices the 8,759 hours a year that I'm not at the doctor's office. OneDrop is rooted in the deep sense of respect for our users and empathy for all the things that they're going through. Many of the employees at OneDrop have chronic conditions, and 100% of employees at OneDrop either have a chronic condition or have somebody in their family that has a chronic condition. So we're operating from a place, again, of deep empathy and respect, and we know how to connect with our audience. OneDrop's services and solutions are rooted in peer-reviewed evidence. We have over 21 peer-reviewed studies that have been published or presented all around the world at different scientific gatherings or in medical journals. Most recently, Jessica, as you mentioned, we partnered with Bayer to expand our offerings into multiple therapeutic areas, including cardiovascular disease, oncology, women's health, and many, many more. And we're very excited to see how that partnership is going to unfold over the coming years. Additionally, again, as you mentioned, Jessica, we recently acquired a continuous real-time health sensing platform from Sano Technologies. We just completed that acquisition last quarter, and we're excited to see how those assets develop inside of the OneDrop ecosystem. For additional, sort of bolstering of our credibility, we're FDA approved for our hardware products. We're American Diabetes Association recognized for our digital health solutions, Health Canada, CE marked, and CDC recognized for our DPP programs. And we deliver tremendous outcomes, whether it's weight loss or whether it's lowering your A1C in just a short period of time, or whether it's helping people with their cholesterol or their high blood pressure. OneDrop is entirely outcomes oriented. And so we're excited to be having our solutions available, not only to the public, but also to be able to deliver the kind of outcomes that we're delivering. I'm asking everybody here on the call to reimagine possible. And I thank you from OneDrop.
Awesome, Jeff. Thank you so much. Hang out with me for a second. We've got a few minutes if you don't mind me asking you a follow-up question. So I love how you opened up, and I love the questions that you encouraged the audience to ask. And I think, in this larger conversation about telehealth and about digital medicines and digital therapeutics and remote monitoring, all the virtual care that's out there. And, this opportunity that's been presented, it's an unfortunate circumstance with COVID-19 and with the pandemic, but it is a tremendous opportunity to prove the value of all of these digital tools. And I love how you said, will this be a missed opportunity for our industry? Yeah. What do you think? How do we make sure that we don't miss the opportunity here? I mean, I think, your encouragement to imagine the possible, I think it starts there. But from your perspective and in your corner of the industry, how are you making sure that you don't miss this opportunity that's been presented to you?
It's interesting, like I said, we're kind of COVID ready from the beginning. We're delivering virtual care. We're delivering it in a way that really resonates with people. Our product is useful and valuable and makes people feel empowered. It gives them education and information and decision-making capability sets that they didn't have before. And so when you can't go to the doctor because the doctor's office is closed and you're on, quarantine, and when you can't connect with a person or some support that you need when you need it. OneDrop and the types of platforms that are similar to OneDrop offer that kind of support. And so, I think we are tailor-made for this opportunity, and we're hoping that the inertia, that the slowness, that the awful bureaucracy that exists in healthcare today, that's rooted in keeping change from happening, right? We're hoping that this crisis, serves as an opportunity to shed a lot of that baggage and move forward. I like to always say, the innovation departments inside healthcare companies are where people's careers go to die, right? It's so hard to get this system moving in the right direction. We've been talking about digital health for how long? You've been covering it for how long, right?
I used to work in a big healthcare company.
I know,
I
right?
got to save my own life and get out.
That's right. And so, now is the time where, anybody with a brain who's thinking about what the future of healthcare is going to look like and how they can capitalize on it will take the opportunity to shed the bureaucracy, shed the slowness, pick up the pace, and invest in the future of digital healthcare. And whether it's OneDrop or models like OneDrop, I think this is the future. People aren't the same way. People aren't going to go back to their offices. There's all this discussion around telecommuting, right? Are people going to go back to work? Are they going to go back to their office? Well, I'm going to ask the healthcare industry: are they going to go back to the doctor's office? Do they want to take time off work and take 2 cabs to try to get to the location and then sit in the doctor's office behind the clickety-clackety computer person who's trying to determine whether they can get paid right away or not before you receive any health or care?
Right.
That's got to stop. We have to make things convenient. We have to make them accessible to people where they are, when they need it, at the moment that it's right for them. That's personalized care. That's where digital healthcare is going. And that's what OneDrop does.
I love it. Viva Digital Health, Jeff. I love it. Inspired. Thank you so much for your perspective. It's so great to catch up and hear what's going on at OneDrop. And I truly inspired and energized by what you just said. So thank you so much for being with us today here.